Okay, this video is medical school a joke? Notice my fancy background right here. It's a sweatshirt just covered on the back of the chair. All right, so basically medical school is obviously a joke, okay? It's been described as being trade school. Dr. McDougall called it trade school. And what I would say is instead of going to be a healer, you learn how to be a drug dealer. It used to be said that medical school was you get the foundation of becoming a good doctor. You learn internal medicine as if that was something meaningful to say and that it helped you be a better doctor in any field you would go into. And here's what I'm going to say. Basically, what internal medicine teaching does, all the textbooks for medical school, they're all wrong. They're wrong in all the major chapters. Not even kind of wrong. They're totally wrong. Okay, and I just tell you that because medical students at the fourth year, they still don't know the causes of any of the common diseases, and they don't know the treatments for any of the common diseases, anything that works, okay? And then basically you say, well, they learn in their residency. That's when they really learn how to be a doctor. No, that's a joke too. You can give me the chief resident from the best Ivy League programs in the whole United States, and I will tell you too, their programs are a joke, and they don't know what they're talking about, and they don't know what causes disease, and they don't know how to cure any of the diseases. That's why they call them chronic, because they don't know how to cure any of them. Okay, you think I'm joking? I am not joking. It's kind of a sad situation. All right, here, let me shrink myself, and I have a little bit of text on the slides. Okay, a typical thing medical students spend a lot of their time doing. You talk to any first-year medical student, they'll tell you that they're learning anatomy, and they go, what does that mean? Well, they memorize the muscle origins and insertion. Like, okay, so here's your bicep, it inserts, around here on your shoulder, then it attaches down to your forearm. Okay, it's all a joke. Okay, the reason that's a joke is because it's like teaching mathematics to a high school student. I actually think that teaching math to a high school student is primarily a joke. You say, well, how could I say that? Look, nobody needs math, all right, other than baby stuff. I'm a triple boarded physician, imaging guided surgeon. I trained in endovascular brain surgery too. I didn't finish that fellowship, but I did that one as well. What I'm trying to say is I don't ever use any math I didn't know by fourth grade. You don't need algebra, calculus, trigonometry, any of that stuff to do the most fancy levels of medicine. There might be some subspecialty where you need a little bit of that for electrophysiologic studies with cardiology or something, but basically nobody needs it, and whatever they need, they can learn it later. What I'm trying to say is when you take a student and you spend years of their life learning stuff that's not useful to them, you're wasting their time. So what I'm saying is all these medical students, they spend tons of time just wasted memorizing muscle origins and insertions, and they don't learn any nutrition. They don't learn any toxicology. They learn almost nothing about epidemiology, and that's what actually tells you what causes diseases and how to prevent it and how to treat it. So they don't learn the useful stuff. And I think it's just a way to keep them busy and distracted while you teach them how to sell drugs. Okay, it's ridiculous. It's a joke. All the common diseases, medical students, including chief residents finishing their training, they don't know what causes coronary artery disease and atherosclerosis. I did a fellowship in vascular disease primarily. It was an interventional imaging guided surgery fellowship at Harvard with the emphasis on vascular disease. And I didn't know it coming out of that fellowship. I learned all this stuff later reading on my own. Okay, so they don't understand heart disease, what causes it. The cardiologists don't know. They don't understand atherosclerosis. I'm telling you, walk up to a cardiologist, ask them what's a zeta potential. They won't know it, all right? Obesity. They don't learn anything about that, anything significant. That's why they all recommend the Mediterranean diet. It's a joke. They don't know hypertension. They don't know diabetes. Those are the main things that make people sick, cause them to die, and also cause dementia. Impotence goes with the same, type of stuff. Okay, they don't know anything about dementia. Look at even the famous dementia books. I talked about the three most famous recent ones. The Greger book, the Bredesen book, the Danton O'Day book, and the Schurzai book. None of them know this stuff. None of them know it. None of them write about it. Dementia, they don't know excitotoxicity, they don't know calcium hypothesis, vascular hypothesis. This is basic stuff, okay? This is the foundation of dementia, and they write entire books and they don't know about it, okay? And they don't know the toxicology, obviously. All right, the other thing too is people should know the significance of female menstruation on blood. That's why women live longer. I've given a bunch of lectures on that before. They should know estrogenic chemicals, okay? There's almost nothing out there that's really good on estrogenic chemicals. The best thing is the Anthony Day book, all right? So what I'm saying is the reason why I say that pre-med education and medical school are a joke and internal medicine residency is a joke because they never learn what causes disease. That's what matters. What causes a disease? Once you know what causes it, you avoid the thing that causes it, okay? It goes on and on. All the common stuff. Leaky gut, autoimmune disease, they don't know it. Abdominal pressure syndrome, Dennis-Burkitt stuff, they don't know it. Food and mood, they don't know it. The psychology and the issues regarding food and mood and everything else about that. The food dyes and all that other stuff. How psychiatry drugs are a big joke. They all cause a chemical lobotomy, okay? It's stupid. All right? And people are trained that this is real medicine. It's nonsense, all right? Cancer. They train everybody in somatic mutation theory. They don't learn the metabolic theory of cancer. You really can't have an intelligent conversation about cancer unless you know metabolic theory. Okay, then it just goes on and on what a joke medical school is. The next thing is, it used to be that they would take a grade and the best students who got the highest score on their boards part 1. It was boards part 1. They often call it step 1, USMLE 1, National Board of Medical Examiners 1. Anyways, the first part of boards was an objective way you could compare students from everywhere in the United States. Or anybody from another place that came to the United States, they would have to take that test. And based on those grades, the universities would have an objective indicator of your academic abilities. I mean, don't get me wrong. It's a question of how much are you willing to study and memorize. Not really how smart you are, but how diligent of a student you are to memorize all that stuff. And it's not a perfect criteria, but it is a useful criteria. Because the students that get the highest grades on that, they're the ones that are probably going to be most willing to study a lot and learn a lot in their residencies. Don't get me wrong. It doesn't mean they're going to be the best doctors, okay? But it means that at least they've got a pretty good academic ability. They now made everything pass or fail, both the grades and the board scores, so that a residency has no objective criteria. And once you have no objective criteria, then you start going by all this other stuff that's totally bogus, okay? Medical students and residents have told me that in order to get a good residency for a lot of the popular fields, you have to have your name on 20 papers as a medical student. Some say 25 or 30 papers. Do you understand what a joke that is? I can tell you in my entire life, I've seen hundreds and hundreds of medical student presentations. I have never once in my life, ever, not once, ever seen a good medical student presentation. They just don't know anything, okay? It's like a joke, and you feel sorry for them. Give them a chance to come up there. Hopefully they'll have a little bit of skills. I've never seen I've seen a few good resident presentations, not much. Residents usually don't know enough either to give a good presentation, okay? And that's because of the way conventional medicine works, okay? But you can train a health coach in a week to be pretty good on these common diseases, okay? But medical students, after 4 years of pre-med, 4 years of medical school, and then 4 years of internal medicine residency plus chief residency, and they still don't know anything about the common diseases. It's pathetic. It's a joke, okay? Because they're basically trained. Everything is of unknown cause, idiopathic, and it's partly genetic. Therefore, take a pill, try to slow it down. That's basically the summary of all the medical textbooks right there. Okay, and then the reason for this is so that they can give unfair preferences to people based on social groups, ethnic groups, that sort of thing, which is ridiculous. That's what that's all about, okay? And when you take away the objectivity, you can get anybody into the most competitive residency. So somebody who just fits the social criteria, whatever that is, they'll get the best possible residencies. And then somebody else who was first in the class but doesn't meet those categories will be denied. This is ridiculous, okay? Don't get me wrong. Medicine went corrupt a long time ago. It didn't just happen recently. And how many diseases do they understand? Virtually none of them. Because I know I talked to tons of medical students, tons of residents and attending physicians. And so all of the common diseases are not taught. And that's why I wrote this book and my other books, because I want to give the docs at least a chance to learn. They go in with good intentions. They want to help the patients, but they get forced into conformity and the system of billing codes and under incredible pressure. You must go faster, you must go faster, you must go faster, because it's an assembly line to crank out billing codes, and whoever cranks out the billing codes makes the most money. So they get forced to do that, and if they don't follow it, then they get screwed. They won't be able to hold a job. So all doctors, in general, pretty much have to go fast and try to generate billing codes. So anyways, I thought you might find that interesting.